COVID-19, a global pandemic that made the world went silent. What is COVID-19? COVID-19 is a disease caused by a new coronavirus called SARS-CoV-2. World Health Organization first learned of this new virus on December 31, 2019, following a report of a cluster of cases of viral pneumonia in Wuhan, People's Republic of China. SARS-CoV-2 spread from person to person through close contacts. When people with COVID-19 breathe out or cough, they expel tiny droplets that contains the virus. These droplets can enter the mouth or nose of someone without the virus, causing an infection to occur. Most common way that this illness spreads is through close contact with someone who has the infection. Close contact is within around 6 feet. Everyone is asked to wear a face mask, especially when they get out of their homes, and do a physical distancing as much as possible.
COVID-19 pandemic has disrupted daily life and slowed the global economy. Thousands of people have been affected by this pandemic, who are either sick or dying as a result of the quickly spreading of the disease. In the first year of fighting COVID-19, vaccines are not yet available for the disease that is infecting humans for the first time. That is why it leads on taking extreme precautions such as following a strict health protocol, wearing masks, observing social distancing, doing a proper hygiene such as washing hands and using alcohol to prevent the virus. This virus is rapidly spreading around the globe. Countries are outlawing public meetings in order to prevent the exponential curve from breaking. To stop the spread of this highly contagious disease, many countries are isolating their citizens and enacting severe quarantines. This social issue creates significant knock-on effects on the daily life of citizens, as well as about the global economy. COVID-19's effects on daily life are currently substantial and have far-reaching ramifications. One of those affected areas in our country is the healthcare, which brought the heavy challenges in the diagnosis, quarantine and treatment of suspected or confirmed cases, and also doctors and other healthcare personnel are overburdened, putting them at risk. Economic. It is also affected which manufacturing of critical commodities is slowing. Product supply chains are disrupted. Domestic and international business is failing, and the economy's cash flow is poor. Social. The service industry is unable to deliver adequate service. Cancellation or postponement of large-scale sports and competitions. Avoidance of national and international travel and service cancellations. Disruption of cultural, religious, and festive activities. Unnecessary stress among the population, and also social estrangement from our peers and family members.
COVID-19 pandemic has been a huge cause why I missed a lot of opportunities. The opportunity to experience studying in the university, hang out with my new friends and classmates, and my chance to learn to become more independent as I was studying in SLSU, which is far away from home. But no matter how excited I am of coming back to the way it was before, I can't. But we can contribute to lessen COVID-19 cases by strictly following the health protocols. Always wear your mask when you go out, observe proper hygiene, and if possible, please always stay indoors. It is true that the flexible learning has lessened our parents' expenses towards our transportation, allowance, and other miscellaneous fees. However, in students, our perspectives, face-to-face classes is way better than the flexible learning. I have been adjusting to this new normal, and in my case, I have faced a lot of difficulty managing my time for my responsibilities at home and my schoolwork, especially when there are some occasions celebrated like birthdays, jams, business also learn how to manage your time wisely so that you will never be left behind. Also, one of the struggles I have experienced aside from managing my schoolwork is distraction. Cell phones and other gadgets are what we used in our flexible learning, and it was a temptation and a battle of choosing surfing through the internet or be productive and finish a certain number of tasks in a day. This really happens to me most of the time, and the solution I had in my mind to avoid distraction is self-discipline. You need to monitor and control your own behavior in order to focus on doing your tasks. We already felt stressed towards our academics even before the flexible learning, but it felt a lot heavier this time for the reason that we are no longer able to go outside and hang out with our friends or take a long walk for some fresh air as our way to cope up with the stress. Although we have social media that can entertain us, but it's really different when you are with your friends. And when we felt stressed, we should never forget to take a break, get enough sleep, eat healthy foods, get exercise, and talk to your friends.
As we know, COVID-19 can be transmitted through water droplets, which the person that is infected produces by talking, sneezing, and coughing. To lessen the risk or even prevent from getting infected, we have our health and safety protocols to follow, like wearing a face mask and face shield, avoiding crowded places, and observing physical distance. And last is always sanitizing or washing our hands. All we have to do is follow this protocol or instruction to minimize the risk of getting infected. And that's why following these simple instructions can really help us save from the virus.
Given the rapidly increasing cases of COVID-19 in the Philippines, community quarantines has been imposed in different parts of the country. There are 4 main levels of community quarantine: the enhanced community quarantine, the modified enhanced community quarantine, the general community quarantine, and the modified general community quarantine. Although exact measures per level may vary over time due to the government revising its guidelines, the strictest of these measures is the ECQ and the most lenient being the MGCQ. The Enhanced Community Quarantine. Localities under an Enhanced Community Quarantine or ECQ are generally ordered to stay at home, with its residents restricted from traveling to other cities or barangays. Barangay governments can issue quarantine passes allowing residents to buy essential goods outside curfew hours and within the issuing barangay's jurisdiction. When ECQ was reintroduced in March of 2021, new set of measures were observed. All households are required to observe strict home quarantine. Movement outside the place of residence is limited to authorized persons outside residence, those accessing essential goods and services, and workers in establishments allowed to operate. People aged 18 years below and above 65, people with comorbidities, and pregnant women are barred from going out their homes except to either obtain essential goods and services or to report for work. Mass gatherings and face-to-face classes are not allowed in ECQ zones. Religious gatherings and dine-in services are not allowed. Shopping malls are allowed to operate for essential services only. Limitation on mass transportation. Essential and priority constructions projects are allowed to resume in accordance with Department of Public Works and Highways guidelines. In addition to frontline services, full operations is allowed for certain operations including agriculture, forestry, aquaculture, and delivery and courier services of essential goods. and limited operation for certain sectors. Unlike in 2020, ECQ measures as of 2021 had more lenient restriction on transportation, allowing for operations of public transportation at a limited capacity. However, with the ECQ period in March-April 2021 coinciding with the Holy Week and late release of guidelines of the Department of Transportation, this resulted in the virtual absence of public transportation in some areas. Although there are many levels of community quarantine, one thing that is common and is imposed in all of this is to stay at home if possible. Only go out when you really have to. Always wear your mask and face shield and avoid close contact with other people. A law that is being imposed in our country to decrease the rapidly increasing cases. Although this community quarantine have brought advantages to us, it also has its negative effects. Some have lost their jobs, negative psychological effects, and some are still adjusting to this new way of living. But one thing is for sure, it is for the better of humanity. And one thing we can do as a citizen of this country is to follow these protocols.
Response of the Philippine government to COVID-19. The Philippine government made the longest and strictest lockdown in the world in responding to the COVID-19 pandemic. The activities and gatherings that may place a lot of people in one place had been suspended to avoid the spread of the virus. As some lost their jobs and complained about not having something to eat, the government provided them with relief goods. The people that still have important work outside their home and those authorized people in your home to go out to get some food for their family needed to have a quarantine pass and QR code. They also need to wear face masks and face shield and need to maintain social distancing as they go outside. The one who will not follow these things as they go outside will be punished. They use the military and police to strictly maintain this kind of new normal activities. As they now have the vaccines for COVID-19, they now urge everyone to be vaccinated, especially those who are government employees.